Obtaining blood work and lab markers is one of the most relied upon ways that doctors assess health and investigate diseases. It's become normal to check blood work. I think it's important to get baseline blood work, but we need to keep in perspective what ranges mean, the reference range versus an optimal range. And really, we're comparing ourselves in modern day. We're not really comparing ourselves to people who lived thousands of years ago. We've been evaluating blood since about the 1600s when blood transfusions became a thing. And then in about the 1950s, we really started pushing for checking blood work, especially with the findings of cholesterol by Ansel Keys as a cause of coronary artery disease. But these ranges have been developed and changed many times over the past 50 years. Since I've been practicing for 27 years, it's changed 4 or 5 times. And the ranges have gotten smaller and smaller. Now, that can be good and bad. Now, let me give you an example. Let's say you're a person who's got symptoms. You got joint aches and pains. You have symptoms of fatigue. You're just not feeling well. You feel sick. Your energy level sucks. You're not sleeping. You're sleeping too much. You're depressed. You're not depressed. I mean, all of these symptoms you talk to your doctor about. They get lab work and they say, hey, everything looks good. I don't know what's going on, but you look good on paper. What about in contrast to the person who changes their lifestyle? They start eating an animal-based diet. They've lost weight. They've reversed their diabetes. Their blood pressure is down. They're off their medications, yet their numbers are out of the reference range. Do we go and correct those numbers because the reference range says that you should be in this range? You see where there can be stark contrast to normals of labs. And over time, in the future, I predict that these ranges will get either wider and wider or narrower and narrower. Okay, right now, we have ranges that set in an agenda for people who need an agenda to be manipulated. For instance, cholesterol. If I want everybody to be on a cholesterol medication, I'm going to narrow that range of normals. If I say that, we're not getting much out of thyroid, let's widen that range. So the range for thyroid disease is very wide. So everybody's going to fit inside the normal, yet you feel crappy. But really, that's how we stay sick. They're manipulating the ranges for us. Who's they? I have no idea. That's why I say they're they. If I knew who they were, I would tell you who they are, but I don't know. But somebody is setting the ranges. And why? But let's get blood work. Let's analyze it together. And let's go from there. Let's talk about your symptoms. Let's look at the big picture instead of just a marker. You guys have a great day. See ya.